My original training is in family medicine, primary care. And so in primary care, we're treating a lot of different diseases and a lot of different chronic diseases. In that, I found myself also counseling people on weight loss and obesity medicine. In the first visit, really what I want to do first is we want to create kind of a safe space, because talking about, weight loss or, weight management can be really difficult and stressful, and it's a very sensitive area for a lot of people. And then I gather a comprehensive history that's, not just around their health history, but also their nutrition, their activity, stress, sleep. Then once we go through the history, then we talk about different treatment options. We connect really well at that first visit, and sometimes there's a lot of information, and so they sort of have to take that home and digest that information. Though I can see sort of light bulbs go on during the visit, and I can see sort of a change in almost excitement kind of coming in and maybe feeling a little bit discouraged or scared, and then sort of leaving like with maybe some more positive energy, and then we just build upon that. Treatment of obesity is just it's comprehensive, it's multifaceted, and it's not just what we think about oftentimes with nutrition and activity and exercise, but it's also optimizing sleep, optimizing stress management. We have a lot of tools in our toolbox that we can use, if something isn't working, and that we really try to take a individualized approach. The most rewarding part of my job is probably that, just to see people sort of understand like that they're really the active player sort of in their health. And this kind of takes me back to sort of why I went into medicine to begin with, is wanting to be more of the liaison. I can provide that knowledge and that information and give people the power to sort of learn a little bit more, so then they can take that control and really be the driver for their health and wellness going forward.